Good evening and welcome to our hour-long forum on the deadly opioid epidemic, something that's not just a problem nationally, but has reared its head in northern Michigan. We have teamed up with Blue Cross Blue Shield Blue Care Network of Michigan to bring you live panel discussions on every aspect of this crisis from inside Traverse City's Denos Museum. But before we get started, what are opioids? Well, they include certain prescription pain relievers, heroin, and synthetic opioids like fentanyl. 115 people die every day from overdosing on opioids. It costs the country $80 billion a year in treatment, in prosecution, and in lost productivity. But it's a pretty hard thing to regulate because they are a lifeline for people with chronic pain. That is why we have split tonight up into 4 separate parts, starting with how did we get here? How did this problem become so bad? Then we're talking with local police agencies and prosecutors to get a better sense of what they're dealing with criminally. We continue by turning the tables, speaking with families who have lost someone to addiction and those who have overcome it. And finally, where can we go from here? Can things get better? Let's hand things over to David Leiden now. He has spent years reporting on this crisis and the impact it's had in northern Michigan. Now, he's going to be in the audience taking questions to ask our 4 panel of experts. He kicks off our first segment tonight with, how did we get here? David?
Yeah, Michelle, it is a complicated question, but it's really only over the last 5 years that this crisis has ramped up, garnering almost daily attention in the news. But to fully understand how we got here, we need to step back in time nearly 3 decades.
It's gotten progressively worse over the last 5-6 years specifically, especially here in northern Michigan.
It seems every week we see another story or hear another unbelievable statistic about the nationwide opioid epidemic. But how did we get here? To find that answer, we have to go back to the 1980s.
There were a couple of articles that suggested that prescription opioids could be really effective for treating pain, but also low risk for addiction. And there were those couple articles in the 80s were cited multiple times as medical evidence. And then you go into the 90s, the pharmaceutical companies were citing those articles from the 80s.
Those same articles were used to promote the use of painkillers like OxyContin. Combine that with a push for pain management, questions about pain on patient satisfaction surveys, and pain included as a vital sign, and there were suddenly large quantities of prescription opioids in medicine cabinets.
We know that we had an overprescribing of opioids too. A lot of people didn't realize how powerful opioids are, and there is a direct correlation between opioids and our heroin epidemic.
And this crisis does not discriminate.
What we're also seeing is people are younger, they're starting to use earlier, and it's really going across every socioeconomic, every gender, racial. We're seeing children who've lost their parents, and so there's just a higher level of trauma throughout the community.
It's left countless people and communities, including northern Michigan, looking and sometimes even begging for some sort of answer to the question, how do we put an end to this crisis?
We know that we're not going to arrest our way out of this problem. It's the human factor. It's the fact that this doesn't discriminate. It does not care who you are, how much money you make, or what background you come from. Addiction is a powerful, powerful thing, and we have some serious questions that we need to answer before we're going to solve this problem.
Thank you so much, David, for helping bring us up to speed. Let's introduce our first panel to answer your questions about the root of the problem now. We start with Dr. Dwayne DeFranco. He is the Senior Medical Director at Blue Cross Blue Shield of Michigan. Lieutenant Todd Ross is the Road Patrol and Operations Supervisor at the Sheboygan County Sheriff's Department. Grand Traverse County Prosecutor Bob Cooney, and Dr. James Whalen. He's the Medical Director for Population Health Management for the Munson Healthcare System. We are going to start with Dr. DeFranco with the basics. Just how big of a problem is opioid use in Michigan?
Right. So, and when you talk about how big is it in Michigan, you have to realize how big of a problem is it nationally. So, I don't think there's anyone in the provider community, the education community, the law enforcement community that thinks that the fact that the president had a commission, our governor had a commission, and there's all of this attention being paid to it is at all overblown. Because when you talk about the number of deaths tripling in the last 5 years in our state, it's a huge problem. And unfortunately, so it's a problem nationally. Michigan ranks 18th in the number of opioid deaths, Michelle, not where we want to be on that list. And in northern Michigan, if you look at some of the heat maps, now the data's, we get this data a couple years, it's always a couple of years old, but 2016, the prescribing rate is relatively high in northern Michigan relative to the state average, and unfortunately, so are the opioid-related deaths. So, problem nationally, worse in Michigan, maybe a bit more of a problem to deal with here in northern Michigan, unfortunately.
Yeah, not what we want to hear. Okay, thank you, Dr. DeFranco. Now to Lieutenant Ross. What does a typical opiate dealer or addict look like?
That's a really good question, and relatively easy to answer, I guess. I believe I heard in your opening statement that it crosses all socioeconomic barriers and boundaries. In my career, I've dealt with an 18-year-old high school student that was a dealer. That was his livelihood. I've also dealt with a 78-year-old retired school teacher that was selling her OxyContin pills in the senior center parking lot in between bridge games. So there is no typical profile for an opiate dealer or addict. It fits everybody in this room and most people in northern Michigan,
right,
or Michigan as a whole.
And to second on that question, what percentage of people in your jail have some connection to opiate addiction?
Our jail averages, now specific to opiate addiction, that's hard to say, but to drug addiction, between 80 and 85%. And that's not all incarcerated for a drug crime. It could be breaking and enterings, property crimes, larcenies, fraud, bad checks, stealing stuff to trade for drugs, stealing stuff to sell in order to get money to buy drugs. But it averages between 80 and 85%.
And I think, Bob Cooney, I think you can add to that. I mean, what kind of impact is this having in our communities?
Well, obviously the deaths are out there. Grand Traverse County Sheriff statistics show approximately 31 deaths in our county alone from opioid drugs. We have health statistics that may show that that number is actually higher than that. We have had 3 overdose deaths from opioid drugs just in a 1-week period, or I think it was a 10-day period in February. We have 4 open delivery of opioid drugs causing death investigations in our office right now, something I never thought I would see. And, we never had heroin in our county that in any significant amount prior to 2012. And it started as a trickle and it's become a rainstorm. And now our law enforcement agencies are dealing with call-outs for overdoses on a weekly basis. We talked about some of the ancillary crimes that are caused by, it's not just drug prosecutions, but also breaking into cars, breaking into homes and businesses, shoplifting that's all generated because it's expensive to have a habit of taking heroin or prescription opioids. And then we also prosecute in our office neglect and abuse cases involving children, and those cases have skyrocketed that involve opioid drugs, and as well as an alarming number of babies being born addicted to opioid drugs. So this is a problem that has greatly impacted our community, and I deal almost on a weekly basis now with people who are struggling with addiction issues or they've lost loved ones because of it.
Yeah, very wide-ranging. And Dr. Whelan, I guess what role does the medical industry play in this? What is their responsibility?
Thanks, Michelle. While the vast majority of physicians are compassionate and responsible providers who would never do anything that would knowingly harm their patients, as the slides earlier showed, their pens still wrote the prescriptions that started us down this path. That said, as evidence has become apparent that that is part of the problem and was contributing to the problem, they've taken this challenge on. And Munson, as a system, has taken this on by creating a toolkit for providers that not only helps them identify people who may be at higher risk for becoming addicted to opioids if they're prescribed, but also to proscribe safe prescribing of opioids, appropriate office procedures to reduce the chance that their prescriptions could be diverted or used inappropriately, or that excess pills would be laying around, and also then to help them connect to the resources to help those already addicted to best treat that condition.
Okay, thank you, Dr. Whelan. And I think we're going to go to David now, who's got a question from the audience for you guys.
Yeah, Michelle, I'm with a woman that we introduced you to actually yesterday on 9 and 10 News. You lost your daughter to a heroin overdose several years ago. Started the foundation, Paige's Promise, to kind of help people that are struggling through drug addiction. And after our story aired last night, got a question to your Facebook page, a very important question. What was that question?
It was from a mom who has a 27-year-old son who's ready to go into recovery. He has Medicaid. Where can she find him help? And he needs long-term recovery, like a lot of people that are addicted. They don't need to go to a inpatient rehab for 2 weeks and then get released. That doesn't help them. They need long-term. And also, we need like rehabs for young and old. This, it's a whole gamut of different things. And I don't know what to tell her because he has Medicaid.
If I can address that, Michelle. So I would start with, well, thank you for the excellent question, and for whoever submitted it to you. We appreciate that concern. And there's no question that treatment services have been a major problem in the North. Access to good programs to help those struggling with addiction have been difficult to find. We had an addiction specialist named Corey Waller present to us who said that Northern Michigan is a treatment desert. That was his words. Luckily, as this attention to this problem has increased, so has the efforts to create more and more treatment resources. I would encourage that family to start with their primary care physician, and they should have access to a resource list. We have it on the Munson website. It's available from Michigan State Medical Society of every type of treatment resource in each community, and they can start to connect them. The Medicaid is a challenge, but like we will hear probably later today, coverage for alternatives to medications for pain, in addition to treatment resources, is a challenge. But I would say that there are resources available that most primary care physicians should be able to connect them to. That is increasing on a monthly basis in terms of those resources.
Great, thank you so much, Dr. Whelan. Our journey into the opioid epidemic is just beginning. When we get back, from overdose reversal drugs to criminal convictions, we have local law enforcement here to learn how this crisis is handled day to day from the people who witness its effects firsthand.
Northern Michigan's Opioid Epidemic, a forum, is brought to you by Blue Cross Blue Shield of Michigan and Blue Care Network and 9 and 10 News.
The people who accomplish so much are always striving to do even more. Now, with our help, they will. It's time for more.
We have a real opioid crisis in the state, and we need to do more. And one of the most effective things we're working on now is the Michigan Automated Prescription System, MAPS, which is where we keep track of prescriptions. And then we can go back and look at where doctors may be overprescribing, pharmacies, where people are getting too many drugs, and we can do follow-up on that. And I think that's going to make a huge difference in terms of helping address the abuse question.
I witnessed him have 2 heart attacks in ICU. He went through seizures.
We'd much rather have Aaron like this than dead. A lot of parents don't have that luxury.
He can't talk. He can't walk. This is a condition Aaron will live with for the rest of his life because he abused prescription pills.
Mind your meds. Learn more from the Partnership for Drug-Free Kids.
Welcome back to our hour-long special, A Forum on the Opioid Epidemic. Before the break, we talked with local experts about how this crisis exploded nationwide and in northern Michigan. And there are people locally who have to deal with the impact of this problem almost every day. That's law enforcement. As David Leiden found out, it is changing the way we police and prescribe. David?
Yeah, Michelle, this epidemic usually leaves everyone from law enforcement, police officers, to prosecutors between a rock and a hard place, balancing the law with saving lives, all while ending this epidemic.
Before hauling people off to jail, we want to help people.
From the courtroom to the streets around northern Michigan, opioid cases have become a regular part of the job for law enforcement across northern Michigan.
It really puts a spotlight on making sure that we're preserving life as well. We really wrap our brain around the fact that we're here to save lives first. Preserve lives, we have to help people first and foremost.
Officers also face more overdose calls involving the deadly opioid carfentanil.
The challenge there for law enforcement is those aren't pills or opiates that are found in somebody's closet or medicine cabinet. That is something that's coming from somebody who's intentionally and illegally obtaining that fentanyl and interjecting it with the heroin.
Law enforcement are also left looking for answers as they continue to try and balance saving lives with ending this epidemic.
One of the most important things that I can do as a prosecutor is use the cases that we have, and where that provides us an opportunity to speak out to the community.
Let's get now to our panel of law enforcement experts. These are the people who spend much of their job dealing with the fallout of the opioid use. Jonathan Hausworth, he's the assistant prosecutor for Manistee County. We've got Detective First Lieutenant Kip Belcher. He's the commander of the multi-jurisdictional task force team in northern Michigan. Traverse City Police Chief Jeff O'Brien, and Detective Sergeant Jared Balisic from the Grand Traverse County Sheriff's Department. We'll start with Jonathan Hausworth. Tell us what opioids are most commonly seen in the criminal justice system.
Well, Michelle, I think if you asked anybody on this panel up here, you might get a different answer depending on what time frame you're talking about. It tends to go in waves. But what I see is most often prescription meds. You're talking about your hydrocodone, morphine, oxycodone, and most recently and most prevalently is fentanyl, which your previous segment probably said was the most dangerous of these that we see because it's so potent. And when this is misused, like for instance injected, which is a common way that that drug is misused, it tends to make people very sick and often die for overdoses and that type of thing.
Okay. Lieutenant Belcher, what is Michigan State Police and its drug task force groups doing to be proactive with today's opiate-related crimes?
Well, what we've done are 2 things that are most important in that realm. And first and foremost is we have structured our complaint investigations with all of our teams in the 7th District to focus much more strongly on conspiracy-related investigations that take a look at the larger level distributors of opioid substances. Oftentimes those individuals are from inner city locations that are larger downstate and in places like Illinois, Indiana, and elsewhere. And those materials are shipped up in bulk, brought up in bulk to our region, Grand Traverse region. So what we've done is do a lot more investigation and lead work, looking at ways to put together complaint investigations that give our prosecutor partners an opportunity to charge those individuals that in years past didn't often see criminal charges coming their way. Another thing that we did, and our captain for the district, Captain Caldwell, helped put together a protocol for us that puts together the resources and the expertise of both our post detectives and our task force detective personnel to step in and investigate overdose situations. So we've got now the combined abilities of both of those sets of people, which makes our ability to put together prosecutable cases much more viable.
Okay, thank you. And Chief O'Brien, what kinds of options does the criminal justice system have in dealing with opioid use?
Thanks, Michelle. I would echo what Lieutenant Belcher is saying, that the focus should be on the dealer, the high-profile dealer, and not so much on the user. We should probably provide naloxone to the user, which we have, and possibly clinics that would also educate families in naloxone, and medically assisted treatment centers is what I think the focus should be on. So our individuals, our officers that work in the field, they're on the front lines. This is not law enforcement's lead. We can't take the lead on this. We don't have the expertise, but we're in a position where we can refer people that are substance use disorders. We can put them in clinics, and state police have the Angel program coming soon to Traverse City and the Traverse City Police Department. We're going to have a similar type HOPE, not handcuffs, where our officers on the front line are going to be referring substance use disorder people to clinics instead of putting them in the criminal justice system.
Okay. And that kind of leads into the question for Detective Sergeant Balisic is, do you see Narcan or naloxone, other overdose reversing drugs, are they becoming a crutch for addicts? Is there a better solution?
Thank you, Michelle. First of all, naloxone is a great thing. It's helped a lot of people, prevented a lot of overdoses. But we have talked to addicts that have told us that they've had parties, so to speak, where they'll have multiple people there, and they'll intentionally take more heroin than they normally would to try to take themselves as close to the edge as they can, and they know if they fall over that edge, that there's someone else there as a safeguard with naloxone that'll bring them back. As far as the second part to your question, I don't know what another alternative would be to it. It is a great thing, but unfortunately, it is used as a crutch at times too.
Okay, thank you guys. David, do we have any questions from the audience?
Yeah, down here with Leelanau County Sheriff Mike Borkovich, and Sheriff, kind of your question, also just kind of talking a little bit about approaching this. You know, we're all human here, law enforcement and everybody else that's involved in this.
That's exactly right. And first of all, I want to commend all of you in law enforcement and the rest of you people here. This is a team effort. This is not just cops and robbers, cops and putting people in jail. This is love, this is faith, this is hope. This is having pride in yourself, in your community. The community be able to pool together our financial resources as well as our personal efforts, as you're seeing here tonight, to make it something that's more of a community-based situation rather than strictly law enforcement. And my specific question, there is a grant called the BURN grant, which has funded local law enforcement's ability to have people go and work with the Traverse Narcotics Team, Flint Area Narcotics Group, FANG, Bayonet, Straits Area Enforcement. These funds have dried up over the years, and we seem to be losing our grip, and it's more and more expensive. I give your county commissioners and ours a lot of credit for funding these positions, but it's becoming very difficult to continue the good work of TNT. And the TNT and the undercover groups will work under the surface of the water, as I heard Lieutenant Dan King say so aptly. They're basically a submarine under the water, and if you come here with major truckloads of dope and you're shipping things and you're a regional distributor, they're the ones that are going to get you. We may stumble on it in the regular law enforcement, but we need that structure. So my specific question would be, what can we all do to build that BURN grant back up and keep law enforcement a priority in this? Because regardless of how much time, money, and effort we put into rehab, there's going to be a point where we have to deal with problem people and the drug sourcing.
And you guys have a good answer to that one. That's a lot.
Well, what I would say about that, Sheriff Borkovich, is that, and you were right on target there, we have seen some diminished amounts of funding from the burn grant over the years. It still is somewhat viable as a funding source, at least for the time being. We have to find ways creatively amongst all of our partnership groups and everybody in the community to be more self-sustaining with our funding for the task force groups. They play such a key role, such a key niche in what they do that other officers are not equipped or trained to do, that we can't risk losing what those people bring to the table as far as their investigative abilities. So we just have to begin now to explore, and we've started doing that in the 7th District with taking a look at some alternate means of making sure that we have the funding in place to keep our task force groups in existence. So we're looking at it right now.
Okay, we have a couple of seconds. We'll get to a quick email question. What are the correctional facilities and courts doing to assist in treatment and rehab as inmates transition back out into the community?
I think I can take that one. We do have the Oaks Correctional Facility in Manistee County, and so we do see a lot of this. The courts have several resources available to them, specifically through the Northern Michigan Regional Entity. I think you have a member here talking about that later. But the Medicated Assisted Treatment Program that the chief mentioned is part of that. Substance abuse counseling, group and individual, is part of that. There's a lot of providers in Northern Michigan that are willing and able to do that and have made the commitment to step up and help out with that. Also, the courts can install short-term sobriety through incarceration, and that's something that I think everybody knows. What they can't do is force long-term sobriety. That is a choice that I believe that every person has to make for themselves. What they can do is support that choice if it's made by being understanding that relapse may be part of recovery and making sure that the funding that we do have is available to support it.
Okay, wonderful. Thank you, gentlemen, very, very much. Now, don't go anywhere. After the break, an emotional sit-down with loved ones of those who have abused the drugs. The brutal consequences, not just for users, but for those who care most about them. Our Opioid Crisis Forum will be right back.
The people who accomplish so much are always striving to do even more. Now, with our help, they will. It's time for more.
That we do have an addiction problem with opioids. How do we, as a coalition, if you will, respond to that, treat those who have the problem, and do everything we can to eliminate the problem going forward. But the idea is, first step is recognition that we have a problem, and it just won't be a federal response that takes care of it. We have to have boots on the ground at the local level.
Everything all right?
Actually, you know how Tom had knee surgery?
Sure.
We found out Brad's been taking his painkillers. And it turns out he's been doing it for a while.
Most people don't know what to say about drugs, but we do. Visit us at drugfree.org.
Welcome back to our Opioid Epidemic Forum, hosted by 9 and 10 News and Blue Cross Blue Shield Blue Care Network of Michigan. We are on part 3 of our live panel discussion from the Dennos Museum in Traverse City. We're talking about the most brutal aspect of the epidemic, addiction. Sadly, many of those stories have to be told by the loved ones of those who abuse the drugs. David?
Yeah, Michelle, the story that I want to tell you is actually from somebody who is on this next panel. Nancy Dow lost her daughter to an opioid overdose, and as she told me, it is almost impossible sometimes to know when someone is struggling. The story you're about to see is not an easy one. It's the story of a Traverse City mother who lost her daughter to an opioid overdose. And we're going to let her tell it.
Dana struggled with addiction to prescription opiates. It began in her early 20s, and it took a while for Dana to really own the fact that she had an addiction to prescription opiates. And when she did, she sought help here. The prescription opiates were prescribed for pain from kidney stones. Then she fell back and relapsed. Dana was ashamed by her relapse and did not reach out to help from any of her friends that were in the NA program because of the stigma behind addiction. It was very hard for her to reach out to anyone, myself included. Just days before Dana passed last April, she was still assuring everyone that she was fine. For me, Dana left me her courage and her voice to help others because Dana loved to help other people. It is my purpose now to try to be her voice and educate and spread awareness so that we can let other people know the risks of the opioid prescriptions.
Just a heartbreaking story, and we have Nancy here with us tonight. Thank you for being here, Nancy. She's part of our panel on the impact this crisis can have on families. Now, Nancy is joined by Lori Ames. Her son is recovering from an opioid addiction, and she is also a prevention specialist. Ken Kaufman lost his son to a heroin overdose in 2016, and Anthony Hamilton is a recovering addict himself. Thank you all so much for being here. And Nancy, we will start with you. What advice would you give a parent who has a child struggling with addiction, and in hindsight, what would you do differently?
I think the most important thing that I could share with a parent that is dealing with a son or daughter that's struggling from addiction is to educate yourself. Be as smart or smarter about the addiction so that you know the difference between helping and enabling. There's a big difference, and I struggled with both with Dana. Know that there's resources out there to help the parents as well, and it's important that you do that for yourself. Share about what your son or daughter is struggling with friends. Don't be ashamed to talk about it to other people. You'll find they may be the biggest resource to lift you up if you just share what's going on. I know in my life it was very important to do that. If I could change anything, I probably would say to not allow someone to tell you they're okay by a text or a phone call. You physically have to go see that person. If I could change anything, I would have gone with my gut feeling, knowing Dana was struggling, and not have listened to a phone conversation or read a text that said, "Mom, I'm fine," because clearly she wasn't.
Thank you very much, Nancy. That's great advice. And Lori, I guess we don't know your background necessarily. You want to share your story with us, please?
Well, I work for Catholic Human Services Up North Prevention, and I came to this job, well, it actually came to me because my son is 33 years old and has been living in this addiction world for 17 years. And I was driven, like Nancy, to make this my purpose, and I was lucky enough to be hired by the greatest place to work for, to get something done. And we've made some real inroads and real changes in northern Michigan that I'm so very proud of, from getting naloxone in the hands of all the law enforcement, and to getting monitoring and securing and disposing, and that whole message out. But my son is alive, and I have sat in rooms full of parents whose children are no longer alive, and sort of feeling a little bit guilty about that and incredibly lucky. But that's what keeps me driven and keeps me moving forward is him. I carry him with me everywhere I go. No one knows, and I agree with everything she said, no one knows the real struggle of addiction like a family member does. And my advice to anyone who has a child or a loved one, it's not all children, is to, just like the AA world says, take one day at a time, and when that person walks through the door, be glad that they walked through and embrace that moment, not what they did in the past, not what they're going to do tomorrow, but what's happening right now.
And what would you say, so many people successfully hide their addiction. How can a loved one know that there's a problem?
Well, we were lucky that our son reached out right from the beginning. The very first time he reached out, he said, "Mom, I just stole pills out of my girlfriend's purse. I have a problem." But several of them do hide it because of the stigma of it and the shame. It comes with such tremendous shame because they're driven to do things they never dreamed they'd do, ever. And so what we can do for that is to help break that stigma and help. I'm trying to get the community to understand addiction, to educate yourselves in the science of addiction, and try to see this as a disease, not a moral failure. Try to treat these people as human beings. The whole controversy about Narcan or naloxone and saving a life, and should we even give it to them because they're going to go out and do more, is ludicrous. You're saving a life, and that life is going to get a second chance or a third chance or a fourth chance. They can't get better if they don't have a chance.
Okay, thank you very much, Lori. And Ken, would you share your story with us as well, please?
Yes. Happy to, Michelle, and thanks to you and 9 and 10 News for putting on this event tonight. It's awesome what you're doing here. My story, my wife and I and our daughter, we lost our son in April, coming up Monday. It'll be 2 years to a heroin overdose. He started out on prescription opioids when he got his wisdom teeth out. And it's a similar story that you hear from a lot of people. And he got clean, and it escalated to more prescription opioids, and he got clean, and he eventually went through chemical engineering school at Michigan Tech and graduated, and eventually got a job in Illinois in his field, and he was working, but it escalated to heroin, and finally he came to us and said he needed to get clean. I'm coming back to Michigan. He entered into the recovery center at Brighton and was clean for 5 months, almost 6 months, and just shy of his 26th birthday, he relapsed and passed away.
I'm so sorry. What have you learned, or what has helped you, I guess, deal with your loss?
Yeah, we've learned so much, and we wish we would have knew some of what we learned after the tragedy unfolded for us ahead of time. And I've been working with Northern Michigan Regional Entity and the Substance Free Coalition of Northwest Michigan and the United Way of Northwest Michigan. And my whole focus and purpose has been to work on prevention, because if you don't ever take the pills in the first place, you'll never become addicted. And people aren't starting out on heroin. So my message is to 3 groups. First is to anybody that's never used a pill, a prescription opioid, don't ever use it unless it's a life and death situation. So that's to parents, students, children, aunts, uncles, grandparents, whoever. The second group I want to address is the doctors and dentists and prescription writers. It's a privilege to write prescriptions. You have to be able to understand that the opioids lead to addiction, and you have to find alternatives to opioids to manage pain. I know there's extreme cases in chronic pain that needs to be addressed, and opioids are the only way. The third group is the pharmaceutical companies. Purdue Pharmaceutical got us into this mess when they escalated OxyContin in the late 1980s. They created this monster, and they have to be part of the solution, just like all of us have to be part of the solution going forward, or we're not going to skin this beast.
Thank you very much, Ken. And moving on to Anthony, who's been in the grips of addiction. Tell us a little bit about your story.
I grew up in a family of addiction, and when my dad passed away when I was about 14 is when my addiction started. It started with prescription pills and marijuana, and it went to be in and out of jails for committing crimes to get my drugs and into a rehab, and it escalated into injecting heroin and prescription pills. And I came up to Traverse City to go to Dekoski in 2016 and have been clean ever since.
Good for you. So tell us, do you think you'll ever be... Yeah. Do you ever think you will be cured from the disease of addiction?
No, I do not. Addiction is a disease I will live with for the rest of my life. Today I work a 12-step program to help manage my symptoms and the disease. But it will be something that I live with for the rest of my life. And to anybody out there in early recovery or trying to get in recovery, best advice is just reach out and ask for help. It does get easier. It's really a struggle every day, but the struggle does get easier.
Thank you so much. And we're very proud of you. Thank you for sharing your story, all of you, very, very much. When we get back, we're taking things in a little more positive direction as we look toward the future. The next panel discusses addiction and treatment. Where do we go from here? What does the end of the opioid crisis look like? All that after the break.
The people who accomplish so much are always striving to do even more. Now, with our help, they will. It's time for more.
Right now, the good news is in the budget we just passed, we have a new $3 billion investment in treating opioids as well as mental health issues, and it will relate to a number of different efforts on prevention and treatment, as well as working with law enforcement. This is a huge issue for us. We have people that are struggling every day. We have people who've lost their loved ones because of this, and we need to take it seriously.
They said I wouldn't get hooked after the first hit.
Hey, stop!
They said I wouldn't get hooked after the first hit. They lied. Find out the truth about drugs. drugfreeworld.org.
We are back. This is the last segment of our hour-long special forum on the opioid crisis. We've looked at how this epidemic became so deadly, law enforcement's hand in stopping it, and what addicts and their families are up against. So where do we go from here? Is there an end in sight? David Leiden is in the audience with a look forward. David.
Michelle, we have spent a lot of time tonight talking about how this problem got so bad. And that means the answer is likely just as complicated, but that does not mean a new approach to an old problem is not a reason for hope.
Everybody is willing to come together to solve this problem.
As the spotlight on the opioid epidemic grows every day, it's not a new problem, but requires a new approach.
Addiction rates, really, when you look at them, have not changed significantly over the course of the last 20 years. What's changed is that drug of choice being opiates, the result being overdoses and deaths.
There's not a one-size-fits-all solution, but people across northern Michigan want to address the crisis head-on, including people like Nicole Flickema at the Health Department of Northwest Michigan.
Our overall goal for all of our initiatives is really to prevent substance use prior to them using. It's not going to just take the health department or the recovery centers or the hospitals. We all have to do it together.
Christopher Heinbaugh, the CEO of Addiction Treatment Services in Traverse City, says while the task of tackling the epidemic can seem daunting, there are reasons for hope.
There are 23 million people in recovery in this country, and we don't hear enough about that. It's a heavy topic, but there is hope. There is opportunity for people to be well and to live healthy lives of their dreams.
As we just heard in David's story, 23 million people in this country are currently in recovery. That is a whole lot of people trying to get better. Our panel, no stranger to that idea. Dr. Dwayne DeFranco is back with us, the Senior Medical Director at Blue Cross Blue Shield of Michigan. Eric Kurtz is the CEO of Northern Michigan Regional Entity. Kate Kerr, the Director of Communications and Outreach for Addiction Treatment Services, and then we are joined again by Dr. James Whalen, the Medical Director for Population Health Management for the Munson Healthcare System. And Dr. DeFranco, what are some of the things that Blue Cross is doing to combat the opioid epidemic, and what results have you been able to achieve?
Right, Michelle, thank you. The stories we heard before the last break are the stories we've been hearing for quite a long time. And I think one of the reasons we're here tonight, honestly, is that the death rates related to opioids have skyrocketed, and that caused everybody to take notice. And of course, that's obviously a very, very serious part of the problem, but in a real way, it's just sort of the tip of the iceberg, because whether there's a fatality involved or not, lives are still being so seriously negatively impacted by this problem. And that's why from our president and CEO down to his executive leadership team and throughout our organization, this has become an explicitly #1 priority for us. And we formed a task force last summer. I co-chair the task force with Todd Anderson, who's in our public policy area. We took an inventory of what we were doing. It turns out we've been doing an awful lot for quite a while, but we needed to boost it up. We needed to integrate it. As the largest health plan in the state, we are perhaps uniquely situated to have a positive impact on this problem. When you're faced with a problem this large and you have that capability, you have an obligation to do everything that you're doing, and that's the seriousness with which we approach the problem. So there are things that we can do as a plan that nobody else can do. We've looked at our benefit structure. We've looked at whether or not there were unintended barriers to people getting access to non-opioid pain treatment. We did that. A big part of the problem, you heard it here in the last segment, is prevention. The scientific evidence is very clear. The pathway to opioid addiction is through prescription drugs today. Wasn't always that way, but it is today. So, and we are flooding our homes with opioids. So we've put in prescription limits, 5-day limit. Some people would argue it should be 0. Some people would argue it would be 3. We're doing what we can. The state passed a law limiting it to 7 for fresh starts. We've got 5. 30-day limit on refills. Those are the other thing we're doing is, in terms of our benefit structure, you know, we sat down with some of our providers and we said, look, what are we doing that's keeping you from providing optimal care? And we came up with a list of ways, new things that we could create novel reimbursement models around, and we're piloting some of those things in the state. Sober coaches, app-based technologies, expanding our utilization management criteria so that initial detox period isn't always so very brief, et cetera. And then, you know, this is, and you told me I had a half hour, right? Okay.
I was gonna be like, well, we want to get to Eric.
Just one more, just one more. This is an all hands on deck problem. Law enforcement, legislators, providers, health plans, communities, everybody needs to be doing their part. We see our role as throwing wind in the sails of these folks. So $600,000 a year to grants throughout the state, including and support sponsorship of events like this. These are ways that we can help get the word out. Our providers need some help, and so we've got provider toolkits that we're creating for them, educational toolkits for them, reimbursement changes to put wind in their sails. I'm sorry to go a bit long, but I'm passionate about this, and it's important to know that, folks have your back.
Clearly, you are passionate. Thank you, Dr. DeFranco. And Eric Kurtz, what does your organization do that makes it a necessary partner in dealing with this problem? Is there anything you're doing that's beyond routine?
Well, first I'd like to start out by, there was a question of where a Medicaid individual would call if they're seeking services. So before I even get into what the Northern Michigan Regional Entity is, I think is important from hearing what was going on, I want to give out an 800 number. It's 1-800-834-3393. So the Northern Michigan Regional Entity is the prepaid inpatient health plan contracted by the state and receives funding for Medicaid and indigent services for individuals with severe mental illness, substance use disorder, and persons with intellectual and developmental disabilities. On the substance use disorder side of it, I feel it's very important, I'm coming from this as a payer perspective, as is Dwayne, that we do hear what is needed, where we can target our resources. We are dealing with Medicaid, we are dealing with state and federal block grants, so where we would like to do services sometimes is a little bit limited but by those regulatory factors. But we are moving on this, and actually in partnership with the state, by October, we're hoping to have opioid health homes introduced into our 21 county region, which would increase the providers of medication-assisted treatment, and within those clinics provide a holistic approach around those services and actually pay for those administrative type functions, making sure the individual gets to their OB-GYN appointment, doing all of those holistic type of things that help somebody on their road to recovery. So we are really excited about that. There has been over 3,100 people identified right now that would fall in or be able to be part of this program. We know there's far more than that. So I know that's just one of the newer things we're doing. We're doing tons of things with prevention, that was mentioned by the earlier panel. But with that, that's where we're headed. So
sounds great.
We're on it.
Some great ideas there. Moving on to Kate, what can the community do to get involved and to help out with this problem?
Yeah, first of all, I would say it's really important to use your voice. You heard from some individuals right here in our community who have lost loved ones or who have loved ones struggling with a disease of addiction. As some of them said, it's really important to educate yourself. Be smarter than a child or a family member who's struggling with addiction, but also educate yourself and your families about what addiction is. Have open conversations, but beyond that, also know what efforts and what initiatives are happening in your community. In our region, in our 5-county region, which is Antrim, Benzie, Kalkaska, Leelanau, and Grand Traverse counties, there are individual coalitions working to combat substance abuse in the counties that we live in. Right now, you can get engaged with those coalitions. You can, support the work that they're doing. You can work with them to advocate, for resources, for education materials, for prevention work. And there's also a 5-county coalition, in this region where people from each of those counties sit on a table to also support the work that's happening in those individual counties. But beyond that, have those conversations. Before I worked in this field, I didn't know how significant the disease of addiction was. I didn't know that it was costing the United States $1 trillion since 2001. We're looking at a public health crisis. I was speaking with Jeff O'Brien earlier, the Traverse City Chief of Police, before we aired tonight, and I was saying that this is a community issue and we all have to band together. So the more that we can come to the table as community members, as parents, as friends, as family members, talk about this disease openly and educate our friends and our families about what addiction is, what the symptoms of overdose look like, where naloxone is available in your communities. It's free. It's available through addiction treatment services, harm reduction. Most pharmacies have it available. to educate yourself on those things so that you don't have any questions if it hits your family, if it impacts your family, if it impacts your friends, your loved ones. You know where the resources are in your community. You're advocating for organizations in your community, and you know where to turn in case there's the case of an overdose in your own family.
Thank you very much, Kate. And Dr. Whalen, we got a lot of emails on this topic. The people who say they legitimately need pain medications, they don't abuse them. There were arguments about, a 7-day supply complicates their life, or they're worried down the road that it's going to be a lot harder for them to get the medications that they need and they've relied on for many, many years. What is your answer to that?
Thank you, Michelle. That's probably the real crux of where providers need to go going forward. That's an extraordinarily difficult discussion that we're having every day in our offices. There are patients who truly do need as strong a pain medication as opioids to get through their days. There are others who believe they need an opioid pain medication to get through their days and probably have a combination of a chronic condition and a tendency towards abuse or overuse. And there are others who really don't, but who would want to. And we have to filter through that. We have to have these difficult conversations with them going forward and push them to use non-medication avenues for treating pain before we ever let them get down this path. I feel like the providers have to apologize to our communities for our role in this. In a sense, I believe in the bottom of my heart that they didn't intentionally get us to this situation, but we do take responsibility going forward. We have to change the way we approach all of this, and those tough conversations with those patients have to go forward.
Thank you all so much. Sadly, we've run out of time. I don't think we have any time to get no time. So thank you all very much. Those were very insightful answers. We hope we've been able to shed a little bit of light on a crisis that's wreaking havoc in our communities every day. Thank you very much, David Leiden, for offering your expertise with this crisis and shedding light on what can be done. And we want to thank, of course, all of our panel participants, all 14 of them, just some of the people who worked tirelessly to put an end to the crisis and save lives along the way, as well as Blue Cross Blue Shield, the Blue Care Network of Michigan for teaming up with us to host this very important event. The Dennis Museum, what a beautiful place to be able to do this, and our audience. Again, this is going to be running again Sunday, April 22nd at 11 a.m. on Local 32, and then at noon on 9 and 10. Thank you so much. Have a great night.